All right, let's talk about something we've probably all taken at some point in our lives: antibiotics. They're absolute lifesavers, truly one of modern medicine's greatest achievements. But here's the thing: using them correctly is way more complicated than you might think. So today, we're going to open up the user manual. So, what's the real story here? Are antibiotics this perfect miracle cure for anything and everything? Or are they more like a powerful heavy-duty weapon that can cause some serious collateral damage if we're not careful? Well, the truth is, they're kind of both. And understanding how to handle this weapon is crucial, not just for you, but for all of us. So, before we can really get to know our weapons, we need to understand the battlefield itself. Inside your body, when you have a bacterial infection, it's basically a war zone. And antibiotics have two main strategies for going on the attack. Okay, so check this out. It's a two-pronged approach. First, you've got your bactericidal antibiotics. These are the special forces. They go in and just straight up kill the bacteria. Done. Penicillin is a perfect example. But then you have the bacteriostatic antibiotics. These are a little more strategic. They don't go for the direct kill. Instead, they stop the bacteria from growing and multiplying. They essentially put the enemy camp under siege so your own immune system can come in and clean up. All right, now that we've got the basic strategies down, let's get specific. It's time to actually look at the weapons in the arsenal. We're going to dive into a few of the major classes of antibiotics, and for each one, we'll cover the single most important side effect that you absolutely have to know about. First up, fluoroquinolones. You might recognize names like ciprofloxacin or Cipro. They get used all the time for things like urinary tract infections, but they carry a very specific and honestly pretty dramatic risk. And here it is. This is a big one. These drugs can actually cause your Achilles tendon, that big tendon on the back of your heel, to shrink and shorten. This can lead to a condition called drop foot, where you can't lift the front of your foot. And in the worst case scenario, that strain can cause a complete rupture. So the takeaway is critical. If you are on this medication and you feel any pain or tightness in your heel, you have to report it to your provider immediately. Next on our list, tetracyclines. These are often the go-to for some nasty stuff like tick-borne illnesses. Think Rocky Mountain spotted fever. And if you're prescribed one, there are two really practical rules you have to follow. This slide lays it out perfectly. First, the burn. And I mean that literally. This pill can actually cause chemical burns in your esophagus if it gets stuck. The fix is so simple. Take it with a big glass of water and stay sitting up for at least half an hour. So definitely don't take it right before bed. Second, the sun. Tetracyclines make your skin crazy sensitive to sunlight. Sunscreen is not optional here. And there's one more critical warning: they can make birth control pills less effective, so you absolutely need a backup method. Okay, now we're bringing out the big guns: vancomycin. This is a really powerful antibiotic, usually given through an IV, and it requires super careful monitoring because of a very unique and well-known reaction. And that reaction is called red man syndrome. It is exactly what it sounds like. If the drug goes into the vein too fast, it can cause this intense flushing, itching, and redness all across the upper body. It looks a lot like a severe allergic reaction, but it's not. It's actually all about the speed of the infusion. So what's the plan if this happens? Well, as you can see, it's a pretty clear three-step process. The nurse stops the infusion right away. Then they let the provider know what's going on. And once they confirm it's just red man syndrome and not a true allergy, the solution is easy. They just restart the IV, but at a much, much slower rate. Now let's see how these warnings play out in a really complex situation, like tuberculosis. To treat active TB, you need a 4-drug cocktail, and it has this great acronym, RIPE. Each drug has its own signature side effect. Rifampicin turns your tears, sweat, and urine orange. It's harmless, but definitely startling if you're not expecting it. Isoniazid can cause nerve damage. Pyrazoniamide can spike your uric acid levels, and ethambutol can cause problems with your vision. It's a powerful combination, and you have to be watching for a very specific set of warnings. So we've gone over the direct side effects, but what happens when these powerful drugs cause friendly fire, when they harm the good bacteria that live in our bodies and actually help protect us? Well, that friendly fire can lead to something called a superinfection. Now, this isn't just getting sick again with something new. A superinfection is a secondary infection that only gets a chance to take hold because the antibiotic you were taking wiped out your body's natural defenses. Think of your gut like a garden. You've got all these good bacteria, your normal flora, that keep things in balance. A broad-spectrum antibiotic is like a powerful weed killer. It gets rid of the bad stuff, but it also wipes out a lot of the good stuff too. This creates a power vacuum, and it allows these other opportunistic germs that were just hanging around to suddenly overgrow and cause a whole new infection. And these aren't some rare, obscure infections. You've probably heard of them. The most notorious is C. diff, which causes terrible diarrhea. Oral thrush, that white film you can get on your tongue, is another classic example. Even some of the really scary antibiotic-resistant bugs like MRSA can thrive when other antibiotics clear out the competition for them. And that leads us directly from a problem inside our own bodies to a crisis that's threatening the entire planet: the rise of antibiotic resistance. Here it is, the simple, terrifying truth. We are in an evolutionary arms race against bacteria, and right now, they are winning. They can adapt and develop defenses against our drugs much, much faster than we can invent new ones to fight them. And what's fueling this crisis? A lot of it comes down to two very human behaviors. First, prescribing antibiotics for things they don't even treat, like a cold or the flu, which are viruses. And second, and this is so important, it's when we start to feel better and stop taking our medicine halfway through. That doesn't kill all the bacteria, it just kills the weakest ones. And it leaves the strongest, most resistant bacteria to survive, multiply, and spread. So, after all that, what can you do about it? This brings us to the final and maybe the most important page of our user manual: your responsibilities when you're taking these incredibly powerful medicines. Let's just run through this checklist together. Number 1, and this is non-negotiable: take the entire course of medicine, even if you feel totally fine. This is our best weapon against creating more resistance. 2, report any side effects. Don't try to tough it out. 3, avoid alcohol. Your liver is already working overtime processing the medicine. 4, remember to use backup contraception if you need it. 5, it's always a good idea to ask your provider about taking probiotics to help rebuild that good gut bacteria. And finally, drink a lot of fluids to help your kidneys flush everything out. Following this user manual isn't just about protecting yourself, it's about protecting these miracle drugs for the future, for everyone. Which leaves us with a pretty sobering final question. As our strongest medicines are slowly losing their power, are we truly ready for what happens next?